Good day, I'm Dr. Christian Jessen. We're about to delve into a topic that affects millions of women worldwide: endometriosis. It's a condition that's often shrouded in silence, misunderstood and misdiagnosed. This leads to unnecessary suffering and a diminished quality of life. Endometriosis is a chronic disease where tissue similar to the uterine lining grows outside the uterus. This tissue can attach to ovaries, fallopian tubes and other organs. It responds to hormonal cycles, thickening and bleeding each month. But unlike the uterine lining, it has nowhere to go, causing pain and inflammation. This can lead to scar tissue and other debilitating symptoms. The impact extends beyond physical discomfort, affecting mental health and relationships. Endometriosis affects 1 in 10 women of reproductive age globally, yet it remains widely misunderstood. The term derives from Greek endo meaning inside, metra meaning uterus and osis meaning condition. It describes tissue resembling the uterine lining growing outside its intended location. Imagine seeds scattered by the wind, landing in unexpected places. This misplaced tissue can cause a cascade of problems within the body. To fully grasp the complexities of endometriosis, it's crucial to understand the normal function of the uterus. The uterus, a pear-shaped organ located in the female pelvis, plays a vital role in reproduction. Its inner lining, the endometrium, is a dynamic tissue that undergoes cyclical changes throughout a woman's menstrual cycle. Under the influence of hormones, the endometrium thickens in preparation for a potential pregnancy. If pregnancy does not occur, the endometrium sheds through the process of menstruation. This cycle of thickening, shedding and renewal is a normal and essential part of a woman's reproductive health. However, in endometriosis, tissue similar to the endometrium grows outside of the uterus, attaching itself to other organs and structures within the pelvic cavity. This misplaced tissue, much like the lining of the uterus, responds to hormonal fluctuations, leading to a monthly cycle of growth, breakdown and bleeding. The lack of awareness and understanding surrounding endometriosis has far-reaching consequences. Women with endometriosis often face significant delays in diagnosis, sometimes enduring years of pain and uncertainty before receiving appropriate medical care. This delay in diagnosis can have a profound impact on their physical, emotional, and social well-being. Furthermore, the misconception that painful periods are normal or something women just have to deal with contributes to the normalization of suffering. This societal perception prevents many women from seeking timely medical attention, perpetuating a cycle of silence and misinformation. It is imperative that we break down these barriers and foster an environment where women feel empowered to advocate for their health and seek the care they deserve. Despite decades of research, the exact causes of endometriosis remain elusive. It's a complex condition with multiple contributing factors, making pinpointing a single cause a challenging endeavor. However, scientists have made significant strides in understanding the potential culprits behind this enigmatic disease. Current research suggests that endometriosis likely arises from a combination of genetic predisposition and environmental triggers. Think of it like a jigsaw puzzle. Various pieces fit together to create the complete picture of endometriosis. Unraveling the mysteries of this disease requires investigating each piece of the puzzle, from genetic variations to environmental exposures. While we may not have all the answers yet, ongoing research continues to shed light on the complex interplay of factors that contribute to the development of endometriosis. By understanding these factors, we can work towards earlier diagnosis, more effective treatments, and ultimately a brighter future for those living with this challenging condition. Genetics plays a crucial role in determining our susceptibility to various diseases, and endometriosis is no exception. Women with a family history of endometriosis are at an increased risk of developing the condition. Certain genes may be involved in making individuals more susceptible to endometriosis. These genes act as blueprints, potentially influencing endometrial tissue. Further research is crucial to fully comprehend the genetic underpinnings of endometriosis. While genetics lays the groundwork, environmental factors may act as triggers, influencing the development and progression of endometriosis. These environmental triggers can be broadly categorized into those that directly affect the immune system and those that disrupt the delicate balance of hormones within the body. Exposure to certain environmental pollutants, such as dioxins and pesticides, has been linked to an increased risk of endometriosis. These chemicals can interfere with the immune system's ability to function correctly, potentially hindering its ability to recognize and eliminate misplaced endometrial tissue. Additionally, some studies suggest that exposure to endocrine-disrupting chemicals, commonly found in plastics, cosmetics, and personal care products, may also play a role in endometriosis development. These chemicals can mimic or interfere with the body's natural hormones, potentially contributing to the growth and spread of endometrial lesions. Section 4. Retrograde menstruation, a leading theory. Retrograde menstruation is a leading theory explaining endometrial tissue outside the uterus. During menstruation, some blood and tissue may flow backward into the pelvic cavity. This retrograde flow doesn't lead to endometriosis in all women. The immune system may clear the misplaced tissue. In endometriosis, the immune response may be compromised, allowing tissue to grow. Retrograde menstruation is a plausible explanation, but doesn't account for all cases. Section 1. The ripple effect. Endometriosis is often described as a whole-body disease because its effects extend far beyond the physical symptoms. The chronic pain, fatigue, and emotional distress associated with endometriosis can have a ripple effect, impacting various aspects of a woman's life, including her relationships, work, and overall well-being. Imagine a spider web, a delicate yet intricate structure meticulously woven together. Now picture a disturbance at the center of the web. The impact reverberates outward, causing tremors and disruptions throughout the entire structure. Similarly, endometriosis can disrupt the delicate balance of a woman's life, impacting her physically, emotionally, and socially. It's crucial to recognize that endometriosis is not merely a gynecological condition. It's a complex disease that can touch every facet of a woman's life. By understanding the far-reaching consequences of endometriosis, we can foster greater empathy, support, and understanding for those navigating the challenges of this often invisible illness. Section 2. The physical toll. The most immediate effect of endometriosis is chronic pain. Pain ranges from dull aches to sharp stabbing sensations, mainly in the pelvic region. It can be constant or intermittent, often worse during menstruation. This pain can make simple tasks unbearable, affecting daily life. The invisible nature of endometriosis often leads to misunderstandings and strained relationships. Partners, family members, and friends may struggle to comprehend the invisible pain and fatigue that plague their loved ones, leading to feelings of isolation, frustration, and resentment on both sides. Imagine trying to explain a color you've never seen or a sound you've never heard. This is the challenge faced by many women with endometriosis as they try to articulate the invisible pain and fatigue that consume their lives. The lack of outward physical symptoms can make it difficult for others to grasp the severity of their condition, leading to feelings of invalidation and dismissal. Open communication is crucial to bridging this gap in understanding. By sharing their experiences, educating their loved ones, and seeking support from those who understand, women with endometriosis can foster stronger, more empathetic relationships. The unpredictable nature of endometriosis symptoms, particularly pain flares, can wreak havoc on a woman's professional and academic life. The need to take frequent sick days, miss deadlines, or leave work early for medical appointments can lead to feelings of guilt, shame, and inadequacy. Imagine trying to focus on a complex task while experiencing waves of debilitating pain, or struggling to stay awake during an important meeting due to overwhelming fatigue. This is the daily reality for many women with endometriosis, who often feel like they're fighting an invisible battle to maintain their professional and academic commitments. The fear of being perceived as unreliable or incapable can be paralyzing, forcing some women to make difficult choices between their health and their careers. Some may reduce their work hours, turn down promotions, or even leave the workforce entirely, sacrificing their financial independence and career aspirations. Endometriosis is a chameleon of a disease, often mimicking other conditions, with its wide array of symptoms. This makes diagnosis tricky, as no single symptom is a surefire indicator. What's more, the severity of these symptoms can vary drastically from woman to woman. Some women may experience mild discomfort, while others face debilitating pain that disrupts their daily lives. This variability in symptom presentation often leads to misdiagnosis and delayed treatment, prolonging the suffering of countless women. It's crucial to remember that pain is not the only symptom of endometriosis. While pelvic pain is common, some women may experience other symptoms more prominently, such as digestive issues, fatigue, or pain during intercourse. Recognizing the diverse ways endometriosis can manifest is essential for early detection and intervention. Pain is the hallmark of endometriosis, but its presentation is far from uniform. Some women describe a dull, persistent ache in their lower abdomen or back, while others experience sharp, stabbing pains that come and go like lightning strikes. Imagine a gentle throbbing that intensifies throughout the day, morphing into a searing, unbearable agony by nightfall. This is the unpredictable nature of endometriosis pain, often leaving women dreading the next flare-up and feeling powerless to control their own bodies. The location of pain can also vary. Some women experience pain primarily in their pelvic region, while others feel it radiating down their legs into their lower back or even up into their chest. This widespread pain can make everyday activities like walking, sitting, or even sleeping a monumental challenge. While endometriosis is primarily associated with pelvic pain, its reach can extend far beyond the reproductive organs. The misplaced endometrial tissue can irritate surrounding nerves and organs, triggering a cascade of seemingly unrelated symptoms. Imagine a domino effect, where the initial impact of endometriosis triggers a chain reaction, leading to a constellation of symptoms that can affect various systems in the body. This interconnectedness makes diagnosing endometriosis even more challenging, as symptoms may mimic other conditions, leading to misdiagnosis and delayed treatment. Digestive issues such as bloating, diarrhea, constipation and nausea are common complaints among women with endometriosis. These symptoms often worsen during menstruation, leading some women to mistake them for premenstrual syndrome or irritable bowel syndrome. The cyclical nature of endometriosis, its tendency to flare up in sync with the menstrual cycle, provides a crucial clue for diagnosis. The misplaced endometrial tissue, like the lining of the uterus, responds to hormonal fluctuations throughout the month. Imagine a monthly roller coaster ride where the highs and lows correspond to the ebb and flow of hormones. For women with endometriosis, these hormonal shifts can trigger a cascade of symptoms, turning each month into a dreaded countdown to pain and discomfort. Heavy menstrual bleeding, often accompanied by painful cramps, is a common symptom of endometriosis. The misplaced endometrial tissue, just like the lining of the uterus, bleeds during menstruation, contributing to a heavier flow. However, unlike the menstrual blood that exits the body, the blood and tissue shed from the misplaced endometrial implants have nowhere to go, leading to inflammation, pain, and the formation of scar tissue. Diagnosing endometriosis can often feel like navigating a complex maze. There's no single test that can definitively identify the condition, and the path to diagnosis is often fraught with delays, misdiagnoses, and frustration. Many women with endometriosis suffer for years before receiving an accurate diagnosis, their pain dismissed as normal period pain or attributed to other conditions. This delay in diagnosis can have a profound impact on their physical and emotional well-being, delaying access to effective treatment and management strategies. The path to diagnosis typically involves a combination of approaches, starting with a thorough medical history, followed by a physical examination, and often involving imaging tests to visualize the pelvic region. In some cases, a laparoscopy, a minimally invasive surgical procedure, may be necessary to confirm the diagnosis and assess the extent of the disease. The first step in the diagnostic journey often involves a conversation, a detailed discussion between the woman and her doctor about her symptoms, medical history, and family history. This conversation is crucial as it provides valuable clues that guide further investigation. The doctor will likely inquire about the nature of the pain, its location, intensity, duration, and any factors that seem to trigger or worsen it. Questions about menstrual cycles, bowel habits, pain during intercourse, and any difficulties conceiving are also relevant, as these can be indicative of endometriosis. Sharing a family history of endometriosis is equally important, as having a close relative with the condition increases the likelihood of developing it. Remember, no detail is too small or insignificant. Be open and honest with your doctor, sharing your experiences and concerns as openly as possible. Following the medical history, a physical examination, particularly a pelvic exam, may be conducted. While this exam can be uncomfortable, especially for women experiencing pelvic pain, a skilled and empathetic doctor will prioritize the patient's comfort and well-being. During the pelvic exam, the doctor will gently feel the abdomen and pelvic area for any abnormalities such as tenderness, masses, or scar tissue. This hands-on examination provides valuable information about the size, shape, and mobility of the reproductive organs, potentially revealing clues suggestive of endometriosis. It's important to remember that the pelvic exam is just one piece of the diagnostic puzzle. Even if the exam doesn't reveal any obvious abnormalities, it doesn't rule out endometriosis. Many women with endometriosis have normal pelvic exams, highlighting the need for a comprehensive diagnostic approach. Section 4. Imaging techniques. Peering inside. Imaging techniques such as ultrasound or magnetic resonance imaging, or MRI, play a crucial role in visualizing the pelvic region, allowing doctors to look for signs of endometriosis that may not be detectable during a physical exam. Ultrasound, a non-invasive technique that uses sound waves to create images of internal organs, is often the first-line imaging test for endometriosis. While ultrasound can detect larger endometrial cysts or masses, it may not always identify smaller lesions or endometrial implants on the pelvic lining. MRI, a more sophisticated imaging technique that uses magnetic fields and radio waves to create detailed images, offers a clearer view of the pelvic structures. MRI is particularly useful in detecting deep infiltrating endometriosis, where endometrial tissue penetrates deep into organs like the bowels or bladder. Section 5. Laparoscopy, a definitive diagnosis. While imaging techniques provide valuable information, the only way to definitively diagnose endometriosis is through a laparoscopy. This minimally invasive surgical procedure allows doctors to directly visualize the pelvic organs and look for endometrial implants. During a laparoscopy, a thin telescope-like instrument called a laparoscope is inserted through a small incision in the abdomen. The laparoscope transmits images to a monitor, providing a magnified view of the pelvic cavity. If endometriosis is present, the surgeon may take a biopsy, a small sample of tissue, for microscopic examination to confirm the diagnosis. The laparoscopy can also be used to surgically remove or destroy endometrial implants, offering both diagnostic and therapeutic benefits. Section 1. The unseen anguish. Endometriosis is a thief. It steals away moments, opportunities, and a sense of normalcy from the lives it touches. But perhaps its cruelest theft is the way it inflicts pain that is often unseen, misunderstood, and underestimated. Imagine a world where your every movement is met with resistance, where a simple cough or laugh sends a jolt of pain through your body. This is the reality for many women with endometriosis, living with the constant fear of their own bodies betraying them. The pain of endometriosis is not just physical. It's deeply personal, weaving its way into the fabric of their lives, impacting their relationships, careers, and their very sense of self. It's a silent struggle, often hidden behind a brave face, as women try to navigate a world that expects them to function as if nothing is wrong. Living with endometriosis often feels like living in a perpetual state of waiting. Waiting for the pain to subside, waiting for a diagnosis, waiting for relief. It's a life punctuated by doctor's appointments, medication schedules, and the constant hope that tomorrow might be a better day. Trying to describe the pain of endometriosis is like trying to capture a storm in a jar. It's a complex, multifaceted experience that defies easy categorization. Some women describe it as a deep, aching pressure, while others liken it to a searing, burning sensation. Imagine a vice tightening around your abdomen, squeezing the air from your lungs, or 1,000 tiny needles pricking your insides. These are just a few of the ways women have described the pain of endometriosis, struggling to find words that adequately convey the intensity and unpredictability of their experience. The pain of endometriosis is not simply a measure of its physical intensity. It's also a reflection of the emotional and psychological burden it carries. Endometriosis is not just a physical ailment. It's an emotional roller coaster that takes its toll on mental health and well-being. The chronic pain, fatigue, and uncertainty of the condition can contribute to anxiety, depression, and a sense of hopelessness. Imagine a heavy cloak of fatigue weighing you down, making it difficult to find the energy to engage in activities you once enjoyed. This pervasive exhaustion, coupled with the relentless pain and the emotional strain of managing a chronic illness, can chip away at even the most resilient spirit. The impact on mental health is often compounded by the social stigma surrounding menstrual health issues. Many women with endometriosis suffer in silence, reluctant to talk about their symptoms for fear of being judged or dismissed. This isolation can further exacerbate feelings of loneliness, shame, and despair. While the experience of endometriosis is deeply personal, there is immense power in shared stories. Connecting with others who understand the invisible pain, the frustrating journey to diagnosis, and the emotional toll of living with this condition can provide a lifeline of support, validation, and hope. Imagine a circle of women sharing their stories, their vulnerabilities, and their triumphs. In this space of shared experience, the isolation that so often accompanies endometriosis begins to dissipate, replaced by a sense of community, understanding, and empowerment. Support groups, online forums, and social media platforms dedicated to endometriosis awareness offer invaluable resources for women seeking connection, information, and a sense of belonging. By sharing their stories, women with endometriosis break down the stigma surrounding the disease, fostering greater awareness, empathy, and understanding. We've journeyed through the complex landscape of endometriosis, exploring its causes, its symptoms, and its profound impact on the lives of millions of women worldwide. But our exploration must not end here. It's time to break the silence surrounding this often invisible illness and shed light on the struggles faced by those living with endometriosis every day. For far too long, endometriosis has been shrouded in mystery, dismissed as just bad periods or something women have to deal with. This lack of awareness and understanding has led to misdiagnosis, delayed treatment, and a profound sense of isolation for countless women. Imagine a world where every woman feels empowered to advocate for her health, where healthcare providers are well versed in the nuances of endometriosis, and where timely diagnosis and effective treatment are the norm. This is the future we must strive for, a future where no woman suffers in silence, her pain dismissed or ignored. Breaking the silence surrounding endometriosis requires a collective effort. A commitment from individuals, healthcare providers, researchers, and policymakers to prioritize women's health and invest in finding solutions for this debilitating condition. We need more research to unravel the mysteries of endometriosis, to identify its root causes, develop more effective treatments, and ultimately find a cure. This research requires adequate funding and a collaborative spirit, bringing together the brightest minds in medicine, science, and technology. Healthcare providers need to be equipped with the knowledge and tools to diagnose endometriosis early and provide compassionate, individualized care. This includes listening attentively to women's experiences, taking their pain seriously, and staying abreast of the latest research and treatment options. While we work towards a future free from endometriosis, it's crucial to support those currently navigating the challenges of this condition. A diagnosis of endometriosis can be overwhelming, often accompanied by a mix of emotions from fear and uncertainty to anger and grief. Imagine yourself in the shoes of a woman newly diagnosed with endometriosis. The pain she's been enduring finally has a name, but with that name comes a wave of new information, treatment options, and potential lifestyle changes to navigate. Friends and family members can provide invaluable support by educating themselves about endometriosis, listening without judgment, and offering practical help when needed. Sometimes the most powerful gift you can offer is simply being present, offering a shoulder to cry on or a listening ear. Endometriosis is a chronic condition, but it doesn't have to define a woman's life. With the right support, women with endometriosis can live full and meaningful lives. Imagine a world where endometriosis is no longer a taboo topic, where women feel empowered to speak openly about their experiences. This is the vision we must hold on to, a vision of a brighter future.